So, hi friends, good morning. My name is Achyut and I'm from Vizag. So, today in this class, we will learn about some more terminologies in medical billing. So, let us get into the class. So, if you find any terminologies repeating, please avoid those terminologies. So, in the previous video, we have learned about a few more 25 terminologies, right? So in that terminologies, if you find any terminologies repeating, please take it as a revise. So let us get into the class. So for what is the first one? Allowed amount. So the maximum amount an insurance company will reimburse for a covered services. So what is the meaning? For example, if a patient go to the hospital and take the treatment from the doctor, so that services will be uh, designed in the code format, and those codes will be implemented in the claim form, and the claim form will be sent to the insurance company. So the insurance company will assess the claim form and will give the allowed amount. So this much amount only we will give to the services which are done by the doctor. So that is called allowed amount. So the maximum amount an insurance company will reimburse for a covered services. So second one is appeal, a request to review a denied or reduced claim. So what is the appeal? So a request to review a denied or reduced claim. So for example, you send the claim to the insurance company. So if it is denied for the CPT or diagnosis or modified code, so then it will be denied for so and so reason. So or you can appeal for the reduced claims. For you are expecting $100, but you got only $50. So then you are appealing. Why you gave only $50? Why don't you give the $100? It is like appealing. So applied to deductible, the portion of the bill that goes towards meeting the patient's deductible. Patient's deductible. So apply towards deductible. So this command we have learned in the previous class. So apply towards deductible, the portion of the bill that goes towards meeting the patient's deductible. So as I told you, the patient will have the deductible amount. For example, take $1,000. So after meeting the $1,000 of the deductible of the patient's money, then only after crossing the deductible amounts of 1,000 rupees, then only it will goes to the insurance company. Then only insurance company will give you the amount. Will give you the amount. Assignment of benefits. An agreement by which insurance payments are made directly to the healthcare provider. So an agreement. So what's the assignment of benefits? An agreement by which insurance payments are made directly to the healthcare provider. So it's an agreement. For example, if a patient goes to the hospital and and take a treatment, so and take a treatment, and patient will the patient will sign on the claim form that whenever I got treatment from the doctor, please give the amount to the directly to the doctor. Like patient is signing assignment of benefits. In the claim form in 32 or 33, there will be a block where the patient will sign. So this is my sign that whenever I go to the hospital and take the treatment, so then you can directly give payments to the doctor by the insurance company. Like he is giving the sign. So that is called assignment of benefits, an agreement by which insurance payments are made directly to the healthcare provider. So who is making an agreement? The patient. Patient is making an agreement. Why patient? Because the patient only, right, taking the insurance card from the insurance company. So he is the person who has to sign on the agreement. And billing cycle, the time period during which bills are prepared and sent. The time period during which bills are prepared and sent. So what is the billing cycle? The time period during which bills are prepared and sent. So after the patient services, so all the services will be transferred into the CPT codes. and with the diagnosis and modifier codes, and that claim form will be sent to the insurance company. So within the time period. So what is the billing cycle? So it is a time period where the claim form will be sent to the insurance company. So that is the time period. So what is capitation? The payment arrangement where a provider is paid set amount for each enrolled person assigned to them. So a payment arrangement where a provider is paid set of amount for each enrolled person assigned to them, which means a certain amount that insurance company, a certain amount an insurance company will pay to the provider. For example, for insurance company paid $30,000 to the provider, which means when a, which means the insurance company is telling to the doctor that if my patient comes to your hospital for n number of times in 30 days, like if there will be time span. For example, there will be 60 days, 90 days, 1 year. So in the 1 year span, he can come to the hospital n number of times. He can get the treatment done, but you should not charge anything to the patient. So this is called capitation. So payment arrangement where a provider is paid a certain amount for each enrolled person assigned to them. So that is called capitation. So I hope you understand the what is called capitation. So the patients can be in n number of patients. Like he will ask the provider that this much of patients will come to you, and this much of amount I'm giving to you. So you have to treat my patients with no charge. So that is called capitation. So what is clean claim? So what is clean claim? The claim that is free from errors can be processed without additional information. Without additional information. What is clean claim? Claim that is free from errors can be processed without additional information. Without additional information. A claim that is free from errors can be processed without additional information, which means what? So the claim should not have any errors, and it should be like after going the claim to the insurance company, it should not be denied. It should not be denied for any other reasons. So you should not ask any additional information from the insurance company to the provider. So that is called clean claim. That is called clean claim. So next one is eighth one. Claim. A request for payment that healthcare provider submits to an insurance company. We know, right? What is claim? A request for payment that healthcare provider. So what is the claim? So the doctor is asking the amount from the insurance company through claim. Through claim. That is called claim. So ninth one is co-insurance. The percentage of the bill for which the patient is responsible after the deductible is met. So as I told you, we have discussed the co-insurance also in the previous class. The percentage of the bill for which the patient is responsible after the deductible is met. After the deductible is met. So co-payment, a fixed amount the patient pays for a covered healthcare services. A fixed amount the patient pays for a covered healthcare services. So I have discussed this co-payment also earlier. So the fixed amount should pay from the patient only for the healthcare services, that is called co-payment. So what is credentialing? So this thing also I have discussed in the earlier class. The process of verifying the qualification of healthcare providers. The process of verifying the qualification of healthcare providers. Healthcare providers. So what is credentialing? Whether the doctor is perfect or not, you have to check through credentialing. So every doctor will be having the NPI number, National Provider Identification Number. With that number, we can identify whether the healthcare provider is a valid healthcare provider or not. That is called credential. And Center for Digital Technology. So this thing also we have discussed in the previous class. A code used to describe medical and surgical and diagnostic code services. A code used to describe medical, surgical, diagnostic services. Date of service. The date when healthcare services are provided. The date when healthcare services were provided. What is the date of service? For example, if I go today to go for treatment, so that is the date of service which is provided by the healthcare provided to the patient. So next one is denial. Refusal by an insurance company to honor a request for payment. So refusal by an insurance company to honor a request for payment. Refusal by an insurance company. So as I told you, right, if you have any errors in your claim, then insurance company absolutely deny your claim. So that is called denial. Diagnosis code. Codes used to describe diseases, symptoms, and conditions. So what is diagnosis code? Codes used to describe diseases. For example, you have lung diseases. For example, you have kidney diseases, and you have symptoms like fever, symptoms like vomiting, and condition. He's having a mind disorder conditions. So all these things are mental conditions. So all these conditions are all these things will describe with the which codes? Diagnosis codes, which is ICD-10. ICD-10. 16th one is electronic claim. The claim submitted electronically to an insurance payer. So claim, what is a claim? What is the electronic claim? Claim submitted electronically to an insurance payer. Explanation of benefits. The statement from the insurance company explaining what cost it will cover. So all these things are explanation of benefits. Guarantor. So person responsible for paying the bill. The person responsible for paying the bill. Who is the guarantor? The person responsible for paying the bill. That is called guarantor. Health maintenance organization. The type of health insurance plan that usually limits coverage to care from doctors who work for or contract with the HMO. A type of health insurance plan that usually limits coverage. So you will having the limited services in the coverage to care from doctors who work for or contract with the HMO. So you will be having the limited amount of services and you perform in the HMO operations. HMO plan. So it's a HMO plan, healthcare plan. So patient will choose different types of plans, right? So in that, it is a HMO plan. And next one is healthcare common procedure coding system, HCPCS. A set of codes used to represent services, supplies, products, and procedures. Set of codes used to represent services, supplies, products, and procedures. A set of codes used to represent services, supplies, products, and procedures. What are HCPCS? What is HCPCS? It's a healthcare common procedure coding system, set of codes used to represent services. For example, a doctor providing services like he got a fever and he is giving the fever procedures, how to cure the fever. Those services will come under the codes HCPCS, Healthcare Common Procedure Coding System. Healthcare Common Procedure Coding System, and supplies, products, procedures, all these codes will come under HCPCS. And we have to know what is in-network provider and out-network providers. These two are very important. Healthcare provider who has a contract with insurance company to provide services to plan member. So the doctor will make a contract with the insurance company to provide services to plan members. So what is a network provider? Who made contract? It's like an agreement from the insurance company to the doctor that he will treat the patients who enrolled in the insurance company. I hope you understand. A provider, for example, who is provider? A doctor. A doctor is agreeing to the insurance company that whenever a patient who registered in the insurance company, X insurance company, and that patient who comes to the hospital, then he will get the treatment done. So that is called in-network provider. What is out-network provider? A healthcare provider who does not have contract with the insurance company. So what is out-network provider? The doctor who does not get agreement, who does not write any agreement from the insurance company, that whoever come a patient from the insurance company who registered in the insurance company, that patient who comes to the hospital and give and try to get the treatment from the doctor will not give the treatment because he did not the doctor did not do the agreement from the insurance company. So a doctor who does not get agreement from the insurance company, that is called that person is called out-network provider. Provider is nothing but a doctor. Pre-authorization. Approval from a health plan that may be required before getting a service or filing a prescription. So pre-authorization means, for example, for important services, you will be having some authorization numbers. For big surgeries, you will be having some authorization numbers. You will be having some authorization numbers, the authorization numbers. Then you will that insurance company will give that authorization number to the patient. So that patient information, that the authorization number, the providers, the doctor should implement that authorization number in the claim form. The authorization number should be implemented in the claim form. So whenever the patient is suffering from critical diseases or critical services, he should be having the authorization number, pre-authorization number, which is provided by the insurance company. Then only the doctor will give treatment to the patient. So whenever the patient gets into the hospital, all these things will checked by the people in the hospital. Pre-registration members will check all these things. So that is called pre-authorization. So premium, the amount paid for your health insurance every month. So what is premium? So for example, you take the insurance plan from the insurance company. So what is the premium you have to pay? So monthly you have to pay for $1,000 or $500. So these are the premiums. So if you pay these premiums, you can go to the hospital and number of times because you're paying the premiums to the insurance company, which is the healthcare plan. So primary care provider, healthcare provider who sees people that have common medical problems. Healthcare provider who sees people with what is PCP? PCP is nothing but like it's a RMP doctor. It's like a RMP doctor. Healthcare provider who sees people that have common medical problems like fever, cough, cold. So all these things under PCP. It is nothing but a RMP doctor. And provider, a term used for health professionals who provide healthcare services. Who is a provider? Provider is nothing but a doctor. A term used for healthcare professional who provide healthcare services. Referral, a written order from your primary care doctor for you to see a specialist or get certain medical services. What is referral? A written order from your primary care doctor for you to see a specialist or to get certain medical services. For example, a patient goes to the RMP doctor. A person is going to the RMP doctor, and RMP doctor checked the patient and he told that you have the lung disorder. You will have the lung disorder that I cannot be cured. Like that knowledge is not there in me to cure the diseases. So that's why as a RMP doctor, as a primary care physician, PCP, I am referring to the professional. I am referring to the professional. So I am referring to the professional. You can go to the professional doctor like our MBBS doctor who is specialized in the lung disorder. So you can go to that provider and you can get the services done. So it's a referral from the RMP doctor to the specialized doctor. So that is called referral. So what is a written order from your primary care doctor for you to see a specialist or get certain medical services? 28. Reimbursement. The payment that the insurance company make directly to the provider for medical services rendered. What is the reimbursement? So the payment that this insurance company make directly to the provider. So reimbursement nothing but, so the insurance company will directly contact the provider and it will make the insurance company will make the payments to them. So revenue cycle management, the financial process that facilitates used to track patient care episodes from registration, appointment scheduling to the final payment. To the final payment. The financial process that facilitates, what is the revenue cycle management? The financial process that facilitates used to track patient care episodes from registration and appointment scheduling to the final payment. So that is nothing but revenue cycle management as we discussed earlier classes, right? So we have discussed about revenue cycle management. So we'll see in depth what is revenue cycle management in the further classes. So what is reimbursement? The payment paid directly to the insurance company. So that is called reimbursement. So what is write-off? The amount that healthcare provider discount and does not expect to collect. So what is write-off? You send the, so the doctor provides treatment to the patient and the patient and the whatever the services which are done that are converted to the courts in the claim, and the claim is sent to the insurance company. Insurance company will give the some amount. So whatever the doctor expecting, that amount will not get to the doctor. Some amount only will get to the doctor by the insurance company. Some CPT codes will write off, like which means will not be paid. So this write off thing, the doctor should not ask to the patient and insurance company also. The doctor should not ask to the patient and insurance company also. Should not ask. So that those things will come under write off. So that is called write off. So I hope you understand the basic terminologies. So if you find any repetition, please take it as revising the terminologies. So these are the very simple terminologies in the medical billing. So that's it, friends. If you find this video helpful for you, please like the video and please share it to your friends and family members so that they can be benefit from this video. And please subscribe to my channel and please ring the bell icon. Then only you'll get the notification, or otherwise you will not get the notification. Thank you, friends. Jai Hind.